There are many physical symptoms of anxiety that people are very comfortable with and very aware of, such as shaking, rapid heartbeat, children maybe turning pale in the face, or having difficulty breathing. But there are also behavioral signs of anxiety that are a little more subtle, that people are not as aware of. Some of those include avoidance. So if children are afraid of school or afraid of animals, they might avoid going near those things. They can also have behavioral outbursts, which are due to anxiety. If they're feeling a lot of tension and frustration around the anxiety that they're having, you might see them explode. Might come out as anger, throwing objects, yelling, screaming, slamming doors. And so the first connection that a parent might make is that my child is having behavioral issues, but it might be stemming from anxiety that's building up inside of them. Children also use what-if language. They say what if a lot and seek reassurance from their parents when they're really struggling with anxiety. What if this happens? What if that happens? And that what if phrase is really important because it becomes a marker for parents to say, oh, I think maybe what you're struggling with is anxiety. The great news for children and families is that anxiety is very easy to treat. It responds very well to a form of therapy called cognitive behavioral therapy. The easiest coping strategies, the main three that I recommend, the first one is breathing techniques. The second is muscle relaxation techniques. And the third is what I refer to as self-talk, talking back to the anxiety and at the same time reassuring yourself that things are going to be okay. There are a number of excellent resources both on the web and in the bookstores that will be helpful to parents as they're working with children with anxiety. In addition to teaching coping strategies, I like parents to also stay optimistic. It can be very difficult to watch children struggle with anxiety, and so I really like them to keep as positive an attitude as possible, that even though this is difficult right now, I know we're going to make it through this. I know that even though the tasks that you're being asked to do by your therapist are challenging, together we can get through it. And that will really help children stick to the program.